I'm here to talk about patients who come frequently to the emergency department or the cardiology clinic with the frequent symptoms of palpitations, dizziness, fatigue, shortness of breath, sometimes chest tightness, and sometimes even syncope or blackout. Those patients might be young and they might be old as well. Sometimes during the examination in the clinic, everything is normal. However, when they go back home, they have a lot of symptoms once again. So for this reason, we had two devices. They are very highly technology and new with the name of loop recorder or event recorder. They usually records what's going on with the patient when the patient is not in the hospital. The first device, it's called a loop recorder or cardiophone. This can stay with the patient from 7 days to 30 days. The patient doesn't have to do any interaction with the device. He just has to press a button whenever he has symptoms. And it works wirelessly, and instantaneously we have the ECG of the patient on the mobile, and then we can call the patient for emergency admission or to come to check with the doctor. Another device which doesn't need much interaction as well, it's called an Estel ECG device. It's like a portable ECG where you have a leads here for the ECG. The patient can just attach to the chest, and through an application on the mobile, he can start recording and share it with the doctor through the WhatsApp, through the email, so that the doctor can know what's going on with the patient when the patient is not around. And there's a new software which is a state-of-the-art cardiovascular imaging modality named speckle tracking or myocardial strain imaging, where we can assess particularly the function of the heart, where the normal conventional echo cannot really estimate. These clinical implications, we can use it for patients who are athletic. Sometimes they have pathology or a big heart, as we say it. Some patients who had a dilated heart. We can even detect early myocardial ischemia for patients who had early signs of coronary heart disease. And through these numbers we can see on the screen, we can tell if that patient has a normal heart or failed heart, or even started to have a heart failure process, so that we can start and implement early treatment for the patient. The colors even estimate when the red color in that bull's eye is more red, that means the patient has a normal heart. When it's more pink, that means the patient has abnormal heart. It's a very specific, particular method. We can measure the function of the heart through measuring the motion of the blood and the tissues inside the heart.